Hello, I am Dr. Rajita, faculty of NEXTFELLOW. So today's topic is on uterus. So here is the sagittal section of female pelvis, where we can see the uterus here. The uterus, and anterior most is the pubis, and uterus continues into the vagina. The lower part of the uterus is the cervix, which is the constricted part of the uterus, and cervix continues to form vagina. And posterior to the uterus and vagina, we can see the rectum and anal canal. And still more posteriorly is the sacrum with coccyx. And anterior to the uterus, we can see the urinary bladder. And anterior to the urinary bladder is pubis. The space between the pubis and the urinary bladder, this area is the retropubic space or space of Retzius. Let's see the position of uterus. Uterus is normally in anteverted and anti-flexed position. In previous image, we saw the uterus is almost bent over the urinary bladder. So it is almost over the superior. It is placed horizontally over the superior wall of the urinary bladder. So these two angles, that is the angle of anteversion or next is the angle of anteflexion. Anteversion is the long axis of the uterus which is bent forward. So you have to take the long axis of the cervix. So this is the long axis of the cervix. This dotted line is the long axis of the cervix. And next is the long axis of the vagina. So this angle, which is written here as vaginocervix angle, it is the angle of anteversion. It is around 90 degrees usually. Next, around the this long axis, that is the anteversion, which is the long axis of vagina against the urinary bladder, and in the anterior bend of the uterus, the angle is between the cervix and vagina. That was about the angle of anteversion. Next, about the angle of anteflexion, it refers to the anterior bend of the uterus at the angle between the cervix and the body of the uterus. So, angle between the long axis of the cervix, then the long axis of the body of the uterus. This angle is the, I'll show it flat. This angle is the angle of anteflexion. So angle of anteflexion usually is around 170 degrees. So this position is very important to keep the position uterus in position instead of dipping down. That is, the prolapse of the uterus is prevented by its position itself. So this is one of the factor which keeps the uterus in position, preventing it from prolapse. Let's see the parts of the uterus. The upper end of the uterus is called as the fundus. It is connected on each side to the fallopian tubes. We can see the fallopian tubes opens into the uterus. And the projection of the uterus into the fallopian tube is called as the cornu of the uterus. And lower part is the cervix, which continues into vagina. So basically uterus is divided into four parts. Fundus is located superior to the cornu and contributes largely to the upper segment of the uterus. So this is fundus, and the fundus, that is the upper segment, it is the normal site of implantation. So it contributes largely in the upper segment during pregnancy, and at term the fundus may extend as high as xiphoid process, that is to the vertebral level T9. Cornu is located near the entry of the uterine tubes. Body is located between the cornu and the cervix. Here are the fallopian tubes on each side. This is the ovary. And here is the cervix, constricted part. Cornu. And here is the body of uterus. So the cornu, we said it is located near the entry of the uterine tubes. Body is located between the cornu and the cervix. The isthmus is Body is located between the cornu and the cervix, and isthmus is the part of the body and is dividing line between the body of the uterus and the cervix. So this constricted part where it separates the body from the cervix is the isthmus. So this constricted part is the isthmus, and if you see the cervix, the opening of the cervix into the body, this opening is the internal os of the cervix. This is considered as the external os of the cervix. So this is the internal os and this is the external os of the cervix. So cervix is located inferior to the body of the uterus and protrudes into the vagina, and cervix contains internal os, external os, and in between the canal is the cervical canal. The external os in nulliparous woman, it is rounded and it is transverse in parous woman. So uterus mainly consists of three layers. The innermost to the outermost, if you see, the innermost layer is the endometrium. So endometrium is the inner epithelial layer along with its mucous membrane and has two layers, the basal layer, functional layer, which thickens and slots during the menstrual cycle, and during pregnancy the uterine glands and the blood vessels in the endometrium increase in size and number, and also the vascular spaces fuse and become interconnected to form the placenta, that is the maternal part of placenta. And next to the endometrium is the myometrium, which is a muscle layer, contains the smooth muscle, and outermost is the perimetrium. Perimetrium is the serous layer of visceral peritoneum covering the outer surface of uterus. Talking about the cervix, cervix is the lower part of the uterus. It measures around 2.5 to 3 centimeters in length. The junction between the cervix and the uterus is the internal os, which is externally corresponds to the isthmus, and the endocervical canal connects the uterine cavity and the vaginal cavity. So this cervical canal, it is the endocervical canal or endocervix, which connects the uterine cavity with the vaginal cavity and extends into the internal os and extends below as the opening as an external os. And cervix is divided into supravaginal portion, which is otherwise called endocervix, which is supravaginal, above to the vaginal level, and from here to here, this part of the cervix till here, drawing, this is the endocervix and this is the ectocervix. So the vaginal portion is the ectocervix, which protrudes into the vagina. And at puberty, the cervix is lined by simple columnar epithelium of endocervical canal, which extends into ectocervix, and its exposure is acidic with the pH of 3. So we can see it is lined by the simple columnar epithelium and its pH is around 3, and which induces the transformation from columnar to stratified squamous epithelium. So before puberty, the cervix is lined by simple columnar epithelium. Once the woman attains the menarche and at puberty, slowly because of acidic exposure, it induces vagina to turn to transformation from columnar to stratified squamous epithelium. Let's see some peritoneal associations with the uterus. So this is the broad ligament which is present on each side. Broad ligament consists of a double layered fold of parietal peritoneum extending from the uterus to the lateral pelvic wall. So here is the uterus. It extends along laterally till the lateral pelvic wall which is present on the either side, uh, forming the wall of the lesser pelvis, and it blends with the covering along the fascia of the pelvic wall. And then this, if you see this broad ligament, it has got the anterior layer and posterior layer. So the main function of the broad ligament, it functions to hold the uterus in position. It does not contain the ovary, but it is attached to the ovary by meso-ovarian. So you can see the posterior wall of the broad ligament, it continues as meso-ovarian. This is the meso-ovarian, where we can see the blue colored structure is the ovary, cut section of ovary. So the first image is the coronal plane, anterior view, and this is the sagittal plane. So the posterior layer that curves from the isthmus. So if you see this broad ligament, posteriorly after covering the body of the uterus, at the isthmus it curves and reflects over the rectum to form the rectouterine fold or rectouterine pouch. And meso-ovarian connects the posterior layer of the broad ligament. You can see the meso-ovarian. I said earlier, the posterior layer of the broad ligament continues to form the meso-ovarian. And next about the mesosalpinx, it is the fold of the broad ligament that suspends the uterine tube. The green colored structure is the mesosalpinx. So here you can see the uterine tube here traveling within the fold of peritoneum, which is called as mesosalpinx, which is the superior continuation of the broad ligament. And we can see the ovary, it is not covered by the peritoneum, but it is connected to the broad ligament by meso-ovarian. So that is the important difference which you have to note here. Next about the mesometrium, which is the rest of the broad ligament. It is a part of broad ligament below the mesosalpinx and meso-ovarian. So broad ligament itself we can divide into mesometrium, mesosalpinx, meso-ovarium. Mesometrium is that part of broad ligament which is associated with uterus. Mesosalpinx is a fold which covers the uterine tube. Meso-ovarian which connects to the that is for ovaries. It connects to the ovaries. So mesosalpinx and meso-ovarium, I hope you understood. And suspensory ligament of ovary, it is which contains the ovarian artery, that you can remember as nerve, artery and vein. So NVB, ovarian neurovascular bundle. So ovarian artery, vein and nerves, and ovarian ligament of uterus, which is the remnant of gubernaculum in the embryo. So these are the contents of meso-ovarian fold of peritoneum, which lie at the base of the. Let's see the contents of this broad ligament. So if you see the contents, it contains the ovarian artery, nerve, vein and that is artery. So we can neurovascular bundle, ovarian neurovascular bundle, and broad ligament also contains the ovarian ligament of uterus, which is a remnant of gubernaculum of embryo. Then uterine tubes and neurovascular bundle like uterine artery, vein and nerves are also present. Usually uterine artery, vein and nerves, they lie at the base of the broad ligament within the transverse cervical ligaments. So you can see the broad ligament below here. This is the base. It continues with inferiorly on each side of the cervix as transverse cervical ligaments or McEnroth's ligaments. So round ligament of the uterus is also a content of broad ligament. Round ligament, which is the remnant of gubernaculum of embryo, and hypophoron and oophoron, which are the remnants of the mesonephric tubules in the embryo, are also present inside the broad ligament. And there are remnants like Gardner's duct, which is a remnant of mesonephric duct in the embryo. And ureters usually lie at the base of the broad ligament. Posterior and inferior to the uterine artery, ureters are present. And also the broad ligament contains some nerve plexus and the lymphatic vessels. So these are the contents of broad ligament. Moving on to most important part, that is the supports of uterus. We can have like muscular supports. Muscular supports are dynamic supports which provide the excellent support to the uterus. The foremost important thing is the pelvic diaphragm. Pelvic diaphragm is made up of levator ana and coccygeus. And not only the pelvic diaphragm, urogenital diaphragm also supports the uterus. Urogenital diaphragm is made up of urethral sphincters and deep transverse perineal muscles. And most importantly, perineal body also. Perineal body, it is a common perineal tendon where it demonstrates the attachments of numerous perineal muscles. And pelvic fascia also condenses. The condensation of the pelvic fascia gives passive support and provides a good support to the uterus. And most importantly, the transverse cervical ligament. So here we can see the urinary bladder on the anterior aspect and sacrum and the rectum on the posterior aspect, and in between we can see the cervical canal. On each side of the cervical canal, here is the lateral wall of the pelvis. So along the from the lateral it blends with the fascia. So this is called transverse cervical ligament, which is otherwise called as McEnroth's ligaments. And these are the cardinal ligaments which supports the uterus. The next important ligaments are pubocervical ligament. As the name suggests, pubo means from the pubis to the cervix. So these are pubate forms like a sling on each side. Pubocervical ligament. We can appreciate in the lateral view also. These are the pubocervical ligaments. Then uterosacral ligaments are the posterior connections from the uterus to the sacrum. These are called uterosacral ligaments. So here is the uterosacral ligament on the lateral view. Peritoneal folds provide poor support. They are just present around the uterus, which are considered as false ligaments, peritoneal folds. Broad ligament we have just discussed previously. But round ligament, it is a fibromuscular support. So it supports in keeping the uterus in position, that is anteflexion and anteverted position, which is a remnant of gubernaculum. Round ligament of uterus is a remnant of gubernaculum in the embryo. And there is some more peritoneal folds like uterovesical fold. Uterovesical fold, here is the urinary bladder and this is the uterus. So the fold of the peritoneum between the uterus and the urinary bladder, this fold is called as uterovesical folds. Usually it contains the coils of small intestine. And posteriorly, the same peritoneum, it reflects and forms a pouch over the rectum. So this is called recto-uterine pouch, which contains the coils of the small intestine and sigmoid colon. So they can be also support to the uterus, but poor supports. And then uterine position itself, that is the axis of the uterus, which I discussed in the second slide as angle of anteflexion and anteversion, which keeps the uterus in position. Next is the transverse cervical ligaments. First we shall talk about these transverse cervical ligaments or McEnroth's ligaments. They are the most important ligaments of uterus, hence they are often called as cardinal ligaments. They are like a fibromuscular condensation of pelvic fascia around the uterine vessels at the base of the broad ligament. They are fan shaped, you can see they are fan shaped on each side. So they are fan shaped, which are extending from the lateral aspect of the cervix to the upper vaginal wall and blends laterally to the lateral pelvic wall. So fascia covering the lateral pelvic wall muscles. They form an hammock and supports the uterus and prevents the downward displacement of uterus. And pubocervical ligaments are a pair of fibrous bands which extend from the cervix to the posterior aspect of the pubic bones. Uterosacral ligaments I have shown already. These are the uterosacral ligaments. Cervical ligaments are here connecting the pubis to the cervix, and this is the uterosacral ligament. So uterosacral ligaments are pair of fibrous bands which extends from the cervix to the second and third sacral vertebra and pass on each side of the rectum. And the forward pull of the round ligaments and help the maintenance of anti-flexed and anteverted positions of uterus. So this is all about the supports of uterus. So discussing about this round ligaments, you can see here, these are the round ligaments, you can see, and we can see on each side fallopian tube. So this is the superior view of the lesser pelvis, where we can see posteriorly sacrum, we can see sacrum on the posterior side, and pubis on the anterior side, symphysis pubis. So the round ligaments of the uterus are the pair of fibromuscular bands which lie between the two layers of broad ligament, and it begins at the lateral angle of the uterus, passes forwards laterally between the two layers of broad ligament, and laterally it passes forward between the two layers. Then it enters the deep inguinal ring. It enters the deep inguinal ring and come out through the superficial inguinal ring. So it enters the deep inguinal ring, passes through the inguinal canal, and deep after winding round the lateral side of inferior epigastric artery, it traverses the inguinal canal and emerges through the superficial inguinal ring. And further, it splits into numerous thread-like fibrous bands which merge with the fibroareolar tissue of labium majus. So finally it ends up into the labium majus, and these ligaments pull the fundus of the uterus forward and helps to maintain the uterus in anteverted and anteflexion position. Then sacrocervical ligaments extend from the lower end of the sacrum to the cervix, and upper end and also it extends from the cervix. So we can see here these are the uterosacral ligament, which are otherwise called sacrocervical ligaments, which connects the sacrum to the cervix and the upper part of the vagina. And rectouterine or sacrouterine ligaments, that is, they are hold the cervix back and upward position, and sometimes elevates like a shelf like a fold of peritoneum, which is called as rectouterine fold, and which passes from the isthmus of the uterus to the posterior wall of the pelvis lateral to the rectum. It corresponds to sacrogenital or rectoprostatic fold in males. So that is about this, and we can appreciate the transverse ligaments also and how it is blending with the lateral wall. This is the cardinal ligament, this is the round ligament and uterosacral ligament, and suspensory ligament of the ovary is a part of broad ligament. Pubovesical ligament, which is between the urinary bladder and the pubis, and pubocervical ligament from the cervix of the uterus to the pubis is the pubocervical ligament. Next, about the arterial supply, uterus is supplied by uterine artery, which is partly by the ovarian arteries. So uterine artery, it is a branch of anterior division of internal iliac artery, which runs medially across the floor. So you can see this is the internal iliac artery. It is internal iliac artery. This is the anterior division. From the anterior division, we see the origin of uterine artery, which is running in the base of the broad ligament. So runs in the base towards the uterine cervix. It passes superiorly to the ureter, then it goes till the ureters, which are present in front or near the upper part of the uterus, and superior lateral to the fornix of the vagina. Then it ascends along the lateral side of the uterus, and as the superior lateral angle of the uterus it reaches, it turns laterally and crosses the uterine tube and anastomosis with the ovarian artery. So we can see the anastomosis between the uterine artery with the ovarian artery. So uterine artery supplies vagina here. We can see as the vaginal arteries, and also part of vagina it supplies. Then it supplies the uterus, medial 2/3 of the uterine tube. It also supplies a little part of uterine tube as well before its anastomosis, and medial 2/3, and also it supplies the ovary, and it supplies the ureter and also the structures within the broad ligament of uterus. So branches near the cervix, after crossing the ureter, it gives the ureteric branches. So after crossing the ureter, it gives rise to ureteric branches, and it gives rise to vaginal branches. You can see one vaginal branch going down, vaginal branches, cervical branches to the cervix. The cervical branches form a circular anastomosis around the isthmus of the uterus, and along the side of the body of the uterus it gives off some arcuate branches. Here we can see the uterine artery on each side within the broad ligament, dividing into arcuate arteries. You can see on each side, anterior and posterior, which further gives rise to radial arteries. You can see here radial arteries, and they divide to form stratum vesiculate within the wall of the uterus. So from the stratum vesiculate, the basal and the spiral arteries are given off to supply the endometrium, and spiral arteries supply the functional zone of the endometrium, which is the casting off during menstruation, and basal arteries supply the basal zone of the endometrium, which supplies in regeneration of denuded endometrium. Venous drainage of the uterus is mainly into the internal iliac veins. We can see it drains into internal iliac veins, which finally drains into the inferior vena cava. So internal iliac veins drains into common iliac veins. Common iliac veins joins to form the inferior vena cava. So we can see the plexus, right uterine plexus and left uterine plexus, forming right uterine artery and left uterine arteries. Next, about the lymphatic drainage, the fundus and the upper part of the body drains into pre and para-aortic lymph nodes. We can see here the fundus and upper part of the body drains into para-aortic or lateral aortic lymph nodes or pre-aortic lymph nodes, which are along these lymphatics travel along the ovarian vessels and along the round ligament of the uterus and drain into, and here the lateral part and the angles of the uterus which travel along the round ligament of the uterus and drain into superficial inguinal lymph nodes, which are external or superficial inguinal lymph nodes on each side. And middle part of the body, the middle part of the body, we can see the middle part of the body which drains into internal iliac lymph nodes, which are along with the internal iliac artery. So from the cervix on each side, the vessels drain into three directions: laterally external iliac and obturator nodes, posterolaterally internal iliac nodes, which are the major drainage, and posteriorly to the sacral nodes. So that is about the lymphatic drainage of uterus. Next, regarding the nerve supply of the uterus, the nerve supply of the uterus is predominantly from the inferior hypogastric plexus. So here we can see inferior hypogastric plexus, These are the inferior hypogastric plexus which supply the uterus and which are carried along the uterine vessels, that is uterine and ovarian arteries, and these nerves ascend with the along the broad ligament along the uterine vessels and connect with the tubal nerves to form the ovarian plexus. So they form the tubal nerves to form the ovarian plexus near the ovaries. The nerve to the cervix is from the plexus that contains a small pre-cervical ganglion. So they are paracervical ganglion, or on each side of the cervix they are present. So they are called paracervical ganglion. And sympathetic preganglionic fibers are derived from T10 to T12 and L1 to L2. So you can see the preganglionic fibers from T10 to T12 and also L1 and L2 gives rise to sympathetic preganglionic efferent fibers, and they are the last thoracic and first lumbar spinal segments with synapse on the postganglionic neurons in the superior and inferior hypogastric plexus. These fibers produce the uterine contraction in non-pregnant uterus, and vasoconstriction, that is the uterine contraction in pregnant uterus, is under oxytocin hormone. So it is not due because of nerves, it is mainly because of oxytocin. So the contraction during pregnancy is due to oxytocin hormone, and in non-pregnant women the contraction is due to the sympathetic preganglionic nerves, that is which are derived from T10 to T12 and L1 to L2, and they are also help in vasoconstriction. So sympathetic preganglionic also causes vasoconstriction. Next, about the parasympathetic preganglionic. Parasympathetic preganglionic arise from S2, S3, S4. So we can see here sacral nerves which are the parasympathetic. So S2 to S4 and relay in the paracervical ganglion, and they cause uterine inhibition and vasodilatation. So they cause uterine inhibition in contraction and vasodilatation, but these activities are complicated by hormonal control for uterine functions. So most afferent sensory fibers from the uterus ascend through the inferior hypogastric plexus and enter the spinal cord through lumbar splanchnic nerves, that is to T10 to T12 and L1 to L2, and along with the corresponding spinal nerves. Coming to the sensory supply, the sensory supply to the cervix and upper part of the birth canal pass through the pelvic splanchnic nerves, which is called as nerva erigentis. The root value of the sensory nerve is S2, S3, S4. And those from the lower portion of the birth canal are primarily supplied by the pudendal nerve. We can see the pudendal nerve which supplies the lower part of the birth canal. So pain during the first stage of labor is initially confined to T11 to T12 dermatomes. So if you see the dermatomal distribution during the pain of first stage of labor, it is because of T11 to T12 dermatomes, that is called as latent phase. But eventually the labor, when it enters the active phase, and much of the pain is due to the dilatation of the cervix and lower uterine segments, and pain through the hypogastric plexus and aortic plexus before entering the spinal cord at T10 and L1 nerve roots. So stretching and compression of the pelvic and perineal structures involve the pudendal nerve with the root value of S2 to S4. And so pain during the second phase of labor involves T10 to S4 dermatomes. So first stage of labor only T1 to L1, second stage of labor both from T1 to L1 and S2 to S4 dermatomes are involved, causing severe pain during second phase of labor. That is latent phase, where the hypogastric and aortic plexus are convey the impulses. During second phase, pudendal nerve, so the T1 to S4, all segments of dermatomes are involved. So this is the thing which has to be noted. The clinical aspects, the spinal anesthesia up to the spinal nerves T10 is necessary to block the pain for the vaginal delivery, and up to the spinal nerves of T4 is cesarean during cesarean section. So the blocking of the nerves till T10 is during vaginal delivery, and blocking of the nerves till T4 for cesarean section due to the sympathetic fiber levels being higher level than the motor and sensory blockage. And lumbar spinal anesthesia, that is the spinal block, in which the anesthetic agent is introduced with a needle into the spinal subarachnoid space, and it anesthetizes the intraperitoneal, subperitoneal and somatic structures, and it produces complete anesthesia inferior to the approximately the waist level. So the perineum, the pelvic floor and the birth canal are anesthetized, and motor and sensory functions are entire lower limbs as well as the sensory. So spinal anesthesia, lumbar spinal block and caudal epidural block and pudendal nerve block. So in caudal epidural block, in which the anesthetic agent is administered during dwelling catheter in the sacral canal, and it anesthetizes the subperitoneal and somatic structures. So the entire birth canal, pelvic floor and most of the peritoneum are anesthetized, but the lower limbs are not usually affected, and the mother is aware of uterine contractions. So let's see some questions associated with the uterus. The following group of lymph nodes receive the lymphatics from the uterus except external iliac, internal iliac, superficial inguinal, deep inguinal. So the lymphatics from the uterus reach the superficial inguinal nodes but not to the deep inguinal nodes. So the answer is deep inguinal. The lymphatics follow the round ligament of the uterus to reach the superficial inguinal lymph nodes. The upper part of the uterus, like fundus, drain into para-aortic and pre-aortic lymph nodes. Lymphatics from the cervix spread towards the external iliac as well as internal iliac lymph nodes. So that is about the lymphatic drainage. So this completes the anatomy of uterus along with its clinical aspects. Thank you.